So good afternoon, ladies and gentlemen. We're going to talk to you about the use of co-production and a WhatsApp broadcast group to improve engagement in type 1 diabetics at North West London Healthcare Trust. Okay, so adolescence is a particularly challenging time. We often see this as a time period where children's glycemic control deteriorates. Many diabetics feel socially isolated and are 2 to 3 times more likely to suffer from mental health issues. This became particularly noted to me when we had a patient who actually turned up in resus in our A&E department, and she was in diabetic ketoacidosis, so she was very unwell with her diabetes, but she was actually just sitting there texting on her mobile phone to her friends, and it started to make me realise maybe we're not making her care most relevant to her. So we started to look at how we could use mobile health technology to engage her. We then decided to collect a group of adolescents from our service in a co-production to see whether they thought this might be a good idea. So we highlighted 6 patients and 4 staff, and we invited a graphic facilitator, and she was there to document their ideas in a creative way, and we came up with various ideas of how we could improve the service. The WhatsApp group was felt to be a fantastic idea, but we were worried about, would this be secure? Would this be safe for patients? We also discussed things like how to improve their care with motivational interviewing and how we could improve by sending each other messages through an iCookbook. Here is a slide of the graphic facilitation from the WhatsApp, from the co-production. So we started to realise that mobile health technology has been used in many different settings. I was very surprised to find out that now more people worldwide had access to mobile phones than they do toothbrushes. So I was worried that our Ealing population, we might be excluding some of our poorest members, but actually none of our patients were not able to have a WhatsApp application because they all had mobile phones. We discovered that we've reduced maternal mortality in India, improved HIV medication adherence in Africa, and even reduced fatal incidents with elephants, all due to mobile health technology. So we thought, surely this is something we could do for our patients. So we started to look at the logistics. We then discovered that we could actually create a broadcast rather than a normal group. Now, essentially, this means that the messages would be sent to a diabetic team member and then be screened before sending to the whole group. And this would ensure patient safety. But we needed to make sure that our trust were happy with this process. So we went and met with our local information risk manager, and we also looked at our local and Caldecott guidelines. And once we realised that this was a robust and safe process, we then took this further forward. We then made sure we had detailed consent forms, making patients and parents aware that although this is secure and we know that it's safe to send to other members of the group, WhatsApp as an actual application, in theory, is like broadcasting on the internet. So anything that you send to the group, which is sent out, you have to be aware that there is a digital footprint. So once that was in the consent process, we were able to go. We now have 23 members, and it is growing, and we also have 4 staff members who are part of the group as well. So for us, we felt that the benefits were that information could be quickly sent out to a large group of patients without anyone feeling particularly singled out. We felt that patients would find it less intimidating and they could be as actively or passively involved as they like. And it allowed sharing of information and experiences between members, so they were actually able to teach each other, which actually has been shown to be a really sustainable way of getting patients involved. We felt it bridged gaps between appointments, and actually patients were able to forge friendships. The risks we felt that we reduced with it being a broadcast were the sort of blurring of professional boundaries, patients finding it intrusive, and the digital footprint which we made clear in the consent process. So here is some examples of pictures and links that patients have been sending each other. So they often use it just, for example, to have a general moan about having to inject every day or find things on the Diabetes UK website. We've also found that they ask each other questions which they might not feel comfortable to ask in clinic, which is really good. And it's really nice that they're answering them in between each other without actually having to get healthcare professionals involved. And then here's some examples. For example, one child was going off to a festival and he wanted to know, has anyone else been and how did they store their insulin? We decided to collect some data to see whether our patients were finding this useful. And actually, qualitative research showed that our patients were overwhelmingly finding this positive, both parents and children. They felt that they could talk to other children with diabetes, which they weren't actually always able to do if they didn't know anyone. And parents felt that it meant that the children didn't feel as isolated. We also did an online SurveyMonkey, and actually all of the patients who responded felt that they'd learned something new from being part of the WhatsApp group, and 67% felt that they were more motivated to manage their diabetes. We also decided to have a look at what their HbA1c control is. So for anyone who doesn't know, that's basically a 3-month snapshot of how your glycemic control is, so how good your control of your diabetes is. We didn't expect with A, such a small sample size, and B, such a small sort of study for there to be any significant difference. It was just more for our interest, really. But we did find a general trend of more patients improving their HbA1cs than not. So in summary, we believe that digital strategies can be easily adopted into diabetes services, and we believe they do improve patient experience and information and engagement. We also think it's a particularly useful strategy for targeting patients who are particularly difficult to engage in our services, particularly as 2 of our patients whose HbA1cs had a big difference were some of our worst clinic attenders. And so it was really nice to see that they engaged with this and they had improvements in their HbA1c. Thank you very much.